Everyone, Dr. Scott here. We're going to talk a little bit today about cervical spondylosis. In other words, this is a condition of the degeneration in the upper part of your spine called the cervical spine, closest to the brain, the brainstem and base of the skull. So the Journal of Clinical Medicine in July 2018, this past year, finished a study associating damage in the cervical spine, in other words, degeneration of the cervical disc, with heart arrhythmia. Now, I've been talking about this, we've known this, it's been well known in the chiropractic community, that if you have damage to the cervical spine and it goes on long enough, it can affect your heart and you don't live as long because of damage to the heart. Obviously, heart arrhythmias can be a very serious issue. So right now, neck problems linked to heart arrhythmias. More than 4 million Americans experience severe heart arrhythmias which accompany additional bothersome signs or symptoms. Those signs or symptoms can be neck pain, headaches, numbness and tingling down the arms and hands, as well as, obviously affecting the organs those nerves control, like the heart, upper respiratory center glands, and your throat. The study showed that people demonstrating even small amounts of cervical wear and tear were up to 3.1 times more likely to suffer from heart arrhythmias. Nerves located in and around the neck link directly to the parts of the heart which influence cardiac electricity. Those are the electrical impulses that keep your heart in rhythm. Provide an explanation for why neck problems are directly associated with heart arrhythmias. Now, how can you get these neck problems? I mean, a whole host of things. I mean, falling down when you're a kid, falling out of a tree, falling off a bike, car wrecks, sports injuries, skiing injuries. I mean, a whole host of things. A lifetime of these small overlapping things, maybe coupled with some big things like a big car accident or something like that. Whiplash injuries are a big culprit for these things. All right. So there's 4 non-pharmaceutical ways to improve your heart. Number 1, regular chiropractic care. Chiropractic adjustments improve neck movement and alignment, improve alignment linked to improving heart arrhythmias. So if you have, this is what a spine looks like. So you should have 3 curves in the spine, one in the neck, one in the mid-back, one in the lower back. This cervical curve we call the arc of life is very important in regards to the function of the heart, because this is where the nerves that control the heart come from. If this has a nice curve in it, that keeps pressure off the disc. The disc lasts a long time, the neck moves properly, the nerves aren't impinged or entrapped. But if you lose that curve in your neck and you start to put forward weight bearing on the spine and your head's up here weighing 14, 15 pounds, that stress puts increased stress on the disc, causes compression of the disc, decreased oxygen, nutrients, and blood flow into the disc. They degenerate faster. You get spondylosis, which begins to put pressure on these nerves. So what we do from a chiropractic standpoint in this office, we actually do corrective care. We correct these problems with people's spines. So that directly improves your overall health and function, not just so you can turn my head better or I feel better, but actually improves your health and your life. So neck pillows, so the cervical pillows, again, that are contoured for the neck, help support the proper curve in the neck. 30% of life is spent sleeping, so proper neck curvature improves the use of a good pillow. Fit while you sit, so we're maintain appropriate workstation space. A lot of us are sitting in front of desks. A lot of people out there sit in front of desks all day in front of a computer. So you want to support good spine alignment and movement and function at your workstation. So have good ergonomics in the workstation. Better sleep, so experiencing an adequate amount of sleep has been linked to improving cases of heart arrhythmias. Black out any light and lower the room temperature down to 68 degrees Fahrenheit to promote better sleep quality. So in other words, sleeping in a cooler room with no light or as little light as possible is going to help. So I hope these tips help you. And again, if you want to find out more about this, you can click the link below and click for our voucher to come into the office and have your neck checked, to have your spine checked to see if there's subluxation or if you have spondylosis, things that we can help and correct in the office naturally without drugs or surgery or anything like that. So hope to see you in the office soon. Dr. Ewing signing off.